Okay, welcome back. Well, we're still keeping our focus on the developments with COVID-19. We've got Dr. Lawan Ghana, who is a Commissioner for Health for Gombe State. He's also the Vice Chairman of the COVID-19 Prevention and Control Committee in the state. Good morning, Dr. Ghana. Thank you for joining us today. How is Gombe State, handling what is going on, the COVID-19 case at the moment? I beg your pardon, Yobe State. How is it being handled now?
Good morning, and thank you for having me. Thank you for having me. At the moment, here in Yobe State, we have 20 cases, confirmed cases of COVID-19, and the state government, through the COVID-19 Prevention and Control Committee, is actually working hard to prevent and control the escalation of the disease across the state. The activities basically that we are conducting as a committee has to do with the fact that we need to actually work very closely with the communities, knowing the importance of behavior change and, of course, cooperation of the communities in the control of this disease. And as such, what we have done is we started with engaging all the 14 emirs of the state last week. And the basic thing is for them to understand that there is need for us to go into deep community dialogue to educate the population about COVID-19, the existence of the disease, and then of course its effects, and then most importantly, for them but then to ensure that the communities don't really panic, but rather take responsibility in terms of observing all the prevention and control methods. The other thing is that we've also engaged the religious institutions, knowing the key roles they play in terms of educating the population. As a committee, we came to some resolutions that we needed to enforce in order to minimize the risk of spread. Resolutions such as the mandatory use of face masks across the state in all public areas. And in order to ensure that this happens, the government, under His Excellency Honorable Mewala Buni, has gone into massive procurement and distribution of the face masks across the states in all the local governments of the state. And this is an ongoing activity which has reached a good level. The second thing is that in order to promote personal and environmental hygiene, hand washing equipment were actually also distributed to key areas, religious religious houses, the markets, and then offices and so on across the 17 LGAs. This is in view to promote proper hand hygiene. The committee also went into issues around environmental hygiene, environmental disinfection. So massive disinfection of the environment was also one of the activities that is ongoing. Just over this weekend, especially the high-risk LGS that were identified, disinfection, 2 rounds of disinfection has actually taken place. Thirdly, the issue of social and physical distancing. In view of course, the cultural and of course the context of the population, this is an aspect that although we have pushed, but then we may not have done very well in that regard. But then by just today, we also have plans to continue intensifying and engaging the communities directly, sit with them so that at least we get to for them to understand the need to observe the physical and, of course, social distancing, especially avoid overcrowding, and the rest. Our interventions basically, what we looked at in the design of our interventions, we really looked at the context of the state, the historical perspective, because the state happens to be one of the states that have been ravaged by the insurgency. And the people have gone through.
How did the state record 150 deaths in 1 week? What happened?
The issue of the death rates that were actually said at the moment. We've done our investigations. We're just completing the data analysis, and by today or by latest by tomorrow, we will make our findings public.
But there's got to be some preliminary findings. So what are they?
The preliminary findings basically, yes, there were some spikes in the death rates, quite okay. And then, of course, we did observe that the death rates were amongst the elderly. But then something that we also found out was the fact that majority of those that passed had comorbidities. And then there was the spike also corresponded to the time when there was the commencement of the Ramadan fasting, and then of course the season. Then it was quite hot. And so basically these are some part of the findings, but then the details of which, like I said, will make it available as soon as the data analysis are completed.
What do you say to some of the people who think that, well, those are characteristics of deaths usually associated with COVID-19?
The issue is that as much as that it may be correct, but then you'll also agree with me that those are also characteristics of deaths that happen when you have different contexts, seasonal variations, when you have some stressors that also occur. Like I said, a lot of the cases, a significant amount of the cases had comorbidities such as hypertension, diabetes, and so on, which of course can be aggravated. And then looking at the society that we're living in, the temperatures can rise as high as 45 degrees. During that period of between the last week of April and till the end of April, temperatures rose up to that level. And the kind of communities that people stay, you have people that are jam-packed in a lot in their houses and the rest. And so this could be a contributor really. But then we've not concluded on anything yet. Like I said, we are leaving everything open, but then while this is all still ongoing and we're not taking anything for granted, we're doing the needful. We didn't stop our interventions. We did have it at the back of our minds of the possibility of that may happen. Of course, that could happen, and that is why we also built in an intervention around the assessment, and which involves active case search, and then linking those that are ill to the health facilities where they will be, they will be properly assessed and diagnosed, so that we do not, have issues around maybe, so that there may be no spread. But then again, largely these mortalities are preventable. And so whether it is COVID or not, there is need to actually intervene to prevent the needless mortality. So actually we did put in the dimension of the interventions.
Well, it's also been said time and again that, density can be a huge contributor to spreading of COVID. And that's why they talk about, that concept of social distancing. But at least one thing is clear. We can't call them mysterious death. I think everyone can agree on that one.
Well, we wouldn't quickly go into that and say it is mysterious. The fact that in the past, around 2 years ago, we actually did observe similar trend in these mortalities, and exactly around this duration at this period. But then again, part of the aftermath of this the assessment is also for us to also go retrospective to compare the trends between the previous years and now. But what we know as a state is that we've observed similar mortalities in the past.
2 years ago, I mean, I'm just curious. What did you find out? What were your discoveries then?
Well, as then, you know, that these are the same issues. That was why we're saying at that same time, we did observe that there was actually an increase. The same information that came from the graveyards and all, and then of course the similar attention was actually drawn. And as then again, we actually did attribute that to the possibility of the weather change. And because usually during the hot weather, in all honesty, we do tend to see mortalities amongst the elderly. And that is why we embark on active campaigns around, prevention of the effects of the weather during on the elderly, and then what people need to do, especially when this weather can, because the weather can be very intense during this period. But again, I'm still emphasizing on the fact that it is not a conclusive thing, and we're not completely, we're not pushing away the current happenings. And so as it is, we're leaving everything open. But then again, like I said, we are trying to take the interventions all together in an integrated manner, so that we don't get distracted by one aspect while the others are still ongoing. So as a state, we tried not to allow other services to suffer. Because we know for a fact that we also have issues around other morbidities. Hypertension, diabetes is still a problem in the state. Issues around overcrowding, density and other things is also a problem, especially in this weather. And then we also understand that the fact that it has been, so there was, the fasting this year came during the hot weather, and the tendency for dehydration, especially amongst the elderly, is very high. So as it is, we're taking all the interventions together. And then, of course, while we're doing the assessments to confirm, or at least for it to give us an angle on the likely cause of some of these morbidities and mortalities.
Well, yeah, underlying ailments too will always worsen any COVID-19 case. But just hold on a moment. We'll come back to you when we return in about 4 minutes from this break. Please stay with us.
Well, welcome back. Dr. Ghana, thank you for staying with us. One thing that will be very vital to the success of these findings, which you said is ongoing. By the way, we need to be sure when you'll release the result of the findings. But one thing that will be very vital to the success is the mode of investigation that is employed. So if you could just let us know, how are you investigating? How are you gathering your data? Have you taken samples? Or what's the mode of the investigation you're employing?
Yes, we actually deployed the standard investigation approaches to these kinds of issues. Basically, we partnered with CDC, WHO, and then, of course, with the state and local governments. We trained the data collectors, and we used electronic data platforms for the data collection. People went to the field. Of course, the areas that had the issues were the urban wards of the respective LGAs. And so they moved from street to street, working with the traditional institutions and community informants. They moved from house to house, asking about the mortalities that happened in those households. And then, of course, like I said, also looking out for possible ill persons in the households that may not have gone to the health facilities, so that they can be linked to health facilities. Graveyards were also visited around that. And then, of course, the health facilities. were also there, and questions were actually asked around the various the symptoms, the signs that have, the symptoms that the deceased manifested. And then, yes, although, it's a retrospective thing. So, and in this society, people are buried when they pass away. So they usually not are kept. But then in those that pass away in the health facilities, of course, samples were also collected and sent for testing. So it's actually a very comprehensive thing that was done. And the analysis is also the ongoing analysis is also very comprehensive and robust. And all these things that we're doing, we're doing them in the interest of our population. There is no any in the politics or anything that has to do with the people's life. Here in Yobe State, the lives and the welfare of the people is very important to us, and so we don't take anything for granted. And that is why we went out to actually look out for the causes of these things, so that and without having a narrow scope, but then we want to have a very wide approach to this, so that we can actually arrive at all the related issues, and then of course interventions will now be carried out.
Well, Dr. Ghana, one of the things that you have told us is that there's been extensive research carried out, and you just mentioned now that some tests were taken. But I've observed that, curiously, in all the conversations that you've heard about, all the things you have told us so far, you haven't mentioned an autopsy conducted. Are we to assume that those samples you took were from the corpses and that they are going to be used for an autopsy?
A verbal autopsy was carried out, and those that passed away in the health facilities, samples were carried out, were taken, and have been sent for testing. But like I said, people that pass away in the communities usually are buried within, after a few hours in line with the religious obligations over here. But then the most important, just as it has been done in all other places, verbal autopsies were actually conducted.
Well, this is a little curious. I don't know if you would agree. This series of events have happened in 4 states in the north. One of them is Kano. Kano is in the northwest. Yobe is in the northeast. And so far, everyone has talked about this verbal autopsy that hasn't, up until now, given us any conclusive, persuasive reasons why these things are occurring. Do you see any similarities in all of these, occurrences in the northwest and the northeast?
You see, the thing is, when you look at the region, the northwest and the northeast, there are similarities, especially in terms of the weather and then in terms of the characteristics of the populations, and so the findings that was seen in those locations are also quite similar to what we are actually seeing, but then like I said, being a robust study, there is need to also wait and see for us to actually see the details of the findings. The thing is, I wouldn't say that these findings have not given anything. But the important thing is embarking on prevention of these mortalities. For the future. And part of it is that once you have established, yes, there is a problem, and of course you've seen the myriads of possibilities of those problems, it's obvious that as a health sector, it is important to actually go out and then, of course, engage with the population, with the communities, and more so that the prevention methods are quite similar. When you look at it, personal hygiene, environmental hygiene, spacing, and so on and so forth. So whatever the kind of, and then of course, early access to healthcare services. are all interventions that once you deploy them, you're likely to actually save more lives from the needless. You save. You can prevent mortalities from the different disease entities that are prevalent in this environment. Of course, yes, there is an ongoing epidemic, and then of course applying such prevention methods is also applicable to that. And then of course, so generally you'll be able to achieve the prevention. So like I said, we as a state have gone all out, engaging those populations that are affected, dialoguing, ensuring that people do understand the implications, and then of course, practicing all the preventive measures that were put in place.
Okay, let me ask you this.
We're working on.
Okay, pardon me to jump in. Could you tell us how does, if you could shed more light on operationalizing verbal autopsy in terms of how it works and how reliable is it if you need to prevent further cases from happening?
Well, you see, the thing is, for every research, there is the first initial step, the initial findings that you get. And then, of course, research is an ongoing thing. So, of course, there will be other further research that will continue while interventions are also happening. In terms of reliability, yes, of course, it might not give you the most conclusive evidence that is needed, but then it also gives you a direction to follow. And the thing is, and it gives you that opportunity to actually design at least some interventions that will be able to assist you in controlling the ongoing events. More so, for example, now that at least, okay, we understand quite clearly that possibility that you have, of course, the epidemic that is ongoing. You have issues around weather, you have issues about comorbidities, and then, of course, you have issues around behavior of the communities, especially with the fact that, the growing stigma around the current epidemic that also prevents people from accessing healthcare services at the right time until things are late. So looking at all that as a system, the best way to go while investigations are still, additional investigations are ongoing, you will have to also go back and really put in place interventions with the information that we have. And this is exactly what we are working as a state.
Are you implying that, since you said verbal autopsy will give you some direction at least, are you implying that if things are not clear with that, you might proceed to do a proper autopsy?
Yes, it's part of it. For instance, of course, for example, let's take, for example, that the verbal autopsy tells you that you have issues around a particular disease entity. It's obvious that, the mortality that go on in the fire facility, for example, you would have to take samples to send them, or more samples to send them for testing. And then, of course, if there is need for a detailed autopsy, of course, yes, the autopsies have to be carried out. It's all about saving lives, and it's all about preventing any future occurrences.
How, just one moment, how effective, Dr. Ghana, has the verbal autopsy been from what happened in Kano before it happened in Yobe? Because if we had sufficient data from the verbal autopsy in Kano and those other states before it happened in Yobe, don't you think we could have been able to prevent what happened in Yobe and a number of other states? So how useful, how sufficient, how symbolic are the data from those other previous states?
You see, the thing is, for every event, for every intervention, or there are limitations. And then, of course, there are variations in the way states design their own interventions. the current epidemic is a new one. There are so many things to learn from the epidemic. And even the interventions that we are designing and, the measures that are being taken, when you look at it, it is still evolving. More stands to be learned from that. So the issue is that within the limitations, you will have to do something in order to minimize the unfortunate occurrences. And I believe that each and every state is the direction that is being followed. But then as it is, when you look at it, of course, people are working hard in terms of trying to put in this prevention and control. And like I'm emphasizing, a disease like this has a lot to do with the behavior of the populations. And one of the most important things to do is to actually work and establish a partnership with the population. Because there are so many dynamics around that. There are so many dynamics around the social, the cultural, the economic context of the people. And there are so wide differences. There are wide variations between the populations. So a lot of things is that I think there is need to further study the populations that we are working on with, and then align our interventions in such a way that it will be easy for people to actually pick up those interventions and then, of course, make it part and parcel of them. Otherwise, these are long-term, these are things that we'll have to do in order to achieve sustainable control of this epidemic and any other epidemic that may actually come up possibly in the future. But there is great need to really study.
All right, well, let's wind down with this one now. Yobe State did say a couple of days ago that they will not be repatriating the Al-majiri in the state. And we thought that northern governors had agreed that that was going to happen to manage COVID-19. Why is Yobe State taking that position?
Some 3 days ago, during the press briefing, you actually heard us say that here in Yobe State, one of the things is that it's a center for learning, and we're working towards improving education, not only the Western education, but also the Quranic education. We are looking at also looking at a situation where when you have such epidemics, moving out people from places that are infected to places that possibly are not infected may not necessarily be a good idea as it is now. Take a typical example, the Al-majiri that were repatriated from Kano to Kaduna. You see that so many were actually tested positive for COVID-19. And then, of course, those in Dutawa were also brought to Jigawa. They also tested positive. If proactive measures were not taken, they would have been actually left to go into the society. And then, of course, they would have actually continued spreading. So I think the teaching basically is that when you have epidemics, you will want to avoid a situation where you move people en masse from one location to other. So the approach that we are taking is to do these things in a systematic manner so that it doesn't really create a panic in the system. The other thing is that we also understand that these are children that would really want to be careful in whatever actions that we take against them, so that they don't feel as if they were neglected, so that to avoid the negative consequences of these actions. But this does not mean that we have allowed things to go on in haphazard manner. No. But we are actually working on doing these things in such a way that it will make sense, and then, of course, it will not create unnecessary distortion of the system.
All right, we do thank you for talking to us this morning, Dr. Lawan Gana, Commissioner for Health and Vice Chairman of the COVID-19 Prevention and Control Committee in Yobe State. We wish you all the best.
Thank you very much. It's my pleasure.